Hello, Irene Goyes here. This is Module 3, Adult Health 2, and the GI disorder I chose for this week is GERD. That's gastroesophageal reflux disorder. Obviously, we can see that saying GERD is a whole lot easier. So that's how I will be referring to it as. So let's get started. The pathophysiology of GERD is basically the lower muscle sphincter of the esophagus relaxes, and then so basically when it relaxes it kind of opens up and allows for the stomach acid to regurgitate or backflow back up to the esophagus. So that is the etiology of GERD. There are no real, I guess, causes of it. There are risk factors that we'll get into a little bit later that increase the risk of GERD. However, that is the basic etiology of GERD. Diagnostic testing that can be used for GERD. I know some providers or specialists, such as otolaryngologist, your ENT provider, we'll use an endoscopy camera. It's a thin, flexible tube that can be put down into your throat area to view. It does have a camera and a light, so the providers can see any inflammation of the esophagus that might be going on. Esopogram is another one that can be done. That will be done through the radiology department. Um, Also, a lot of it is just using the information, the subjective information that you get from your patient. For example, some of the clinical manifestations that they might complain of are burning, right? So you can imagine that there's a stomach acid burning or going back up into the esophagus, so it burns. A lot of patients complain that they have chest pain or like a heartburn, and that is the acid burning, basically burning in a sense the esophagus. It does worsen at night, and that is because we tend to relax everything at nighttime. So with that goes the relaxation of that sphincter muscle of the esophagus. Some patients might complain of difficulty of swallowing or constant clearing of your throat or voice changes as well. The interprofessional care that should be provided, well, you're going to have a whole team of people, right? You have the CNA that comes and does the vital signs, the nurse who might do their assessment. You have the provider that comes in and does their own assessment and who does the endoscope exam if needed, if they feel like they need to go in there and visualize a little bit more, and then the radiologist if you are sending them for an esophagram. The treatment plan I will go into a little bit later with patient teaching, but medications that can be used for this disease, GERD, are proton pump inhibitors, PPIs, or H2 receptor blockers. An example of a PPI is omeprazole or Prilosec, is a more familiar name. And but use caution when utilizing this medication, especially in the older adult population, as it does cause weakness in the bones. So patients are more, it could be easier for them to have like hip fractures and whatnot. And the example of a H2 receptor blocker would be Pepcid or Tagamet. I've seen patients on one of each. It just depends on the situation and the symptoms that the patient is experiencing. So those are just some medications that the patient can use. Um, and so the nursing process to develop a plan of care for the patient will a good nursing diagnosis that I found was the ineffective health maintenance, and that was related to deficient knowledge regarding the anti-reflux regimen. They may have never heard of GERD before. They may not even know that they're contributing to their disease by the risk factors that they're doing, right? So a plan for the patient will be that the patient will mutually agree on the healthcare maintenance plan. But in order to do that, the nurse must implement the intervention to assess for, their economic issues, their spiritual, their culture patterns that may influence their compliance with the regimen to follow. So that's important. And then, of course, we would evaluate to see if our plan did work. But going back to treatment plan and patient teaching, the reason why we want to assess for these culture patterns and whatnot is because that might play into a risk factor. For example, if it's a culture that eats lots of fried or greasy foods, that contributes, that's considered a risk factor. If that person lifestyle is to smoke, that's also a risk factor and can contribute to the increased symptoms of GERD. So lots of patient teaching. We want to make sure we keep their head of bed up. Generally, people can use books to literally put under the poles of their headboard, and that will put their head of bed elevated. So no need for a fancy hospital bed or anything like that. And that is pretty much, that concludes my video. So thank you for watching.